This report brought to you by the Richmond Club, where investors and high-growth companies meet.
Our next speaker is the President and CEO of PreveCeutical Medical. Please welcome Mr. Stephen Van Deventer.
Well, it's good to see everybody here today. Thank you for coming. Appreciate it. A little bit about PreveCeutical. First of all, we're listed on the Canadian Stock Exchange. Trading ticker symbol is PREV. So a little bit of what we do. So PreveCeutical is a preventive health company. We're working on preventive therapies and curative therapies. And at this point, we have 4 different R&D programs that we've been working on for the last few years. And these programs are now starting to come to their final stages, and we have a lot of successful results today. You know, our vision is to be a true leader in the preventive health industry. You know, in the past, all type of medical companies are being more like a Band-Aid solution. We're trying to find solutions that we can solve the issues rather than having to, to put Band-Aids on them, so we can get in front of them before they happen. So a couple of our recent achievements we have on our Sol Gel program. What Sol Gel is a soluble gel. And what this means is it's a liquid form that we're going to put into a nasal applicator, and you spray this nasal applicator into your nostrils. It will actually hit the mucosa at the top underneath the brain-blood barrier. This Sol Gel then will sit there for 7 days, and we can time release the cannabinoids into that. So if you've seen you see some of these kids or people that have seizures, and then they take some of the CBD or whatever type of cannabinoid that's required, then the seizures dissipate. Well, that's not really preventing it. That's a treatment after the fact. So what we're doing now is to be able to provide this through the mucosa, time release it over 7 days, and because of the bioavailability, it's upwards of 95% of the product can get into your system very effectively, and we can time release it. We're basically moving through fast track on that. We just got approvals by the University of Queensland and the Ethics Commission in Australia, is where we're doing our R&D to use basically human tissue. So we received that human tissue, and that's all pretty much our last stage. Once we complete that in the next few months, we'll have IND, which is investigative new drug status on that. Second thing, that's one of our larger projects, is the diabetes and obesity dual gene therapy program. So our scientists have identified within the body that there's a certain gene responsible for both diabetes and obesity. So what we can do now is we can take anyone's blood from a child, from anyone, and tell you that one day you'll have obesity or you will have diabetes because of a certain marker in your system. So how do we resolve this is one of the questions we've been working on for a while. And that's basically to learn how to silence that gene. So we've been working on it. We have basically 4 possibly more high potent and novel silencing siRNA candidates. And so far we've been delivered to be able to silence the gene up to 80%. So the 4 programs we have, as I said, is the Sol Gel, known to nose to brain delivery with the cannabinoids. Once that's complete, we can then, we've taken 5 different strains already that we imported from Aurora Cannabis in Canada here, exported into Australia, and we've fingerprinted all those, so we have all the different cannabinoids there and infusing them for the different ailments. But the Sol Gel program is not only just for the cannabinoids. Once this is all proven out, which will be in the next few months, we then can infuse anything. This is any type of drug that can be delivered on a time release basis through the nasal cavities without having to take much more orally. Your digestive system will burn most of this up. So your bioavailability via your oral system is about 15 to 20%. So this gives us a much more higher dosage of it. Next thing we have is the nature-identical synthetic peptides that we're using for aggressive brain cancers. And this stage is also in the final stages, I believe, in the last 2 months here, and that'll also be in the IND, which is the initial new drug, and we have some really great results on that. The 2 other programs, the non-addictive allergistic peptides, is basically a dynorphins that we use. Your body secretes, when you cut yourself or you get injured, your brain actually secretes a certain fluid. And this fluid is more powerful than any type of drug on the market because it's your body's natural system to basically counteract the pain effects. The issue with that is why you feel pain is after a while that it's only suspends for a few seconds. After those few seconds, the pain then kicks in. So we've been able to, while people are in the surgery stuff, take that fluid and duplicate that fluid. And what's critical about this is that fluid is more powerful than any type of opioid, any type of morphine, or any type of other drugs like them. However, it doesn't sit on certain receptors. And these receptors are quite critical because once they, for example, the opioids, people start creating tolerance, so they have to take more. So they start at 5 milligrams, 10, 20, get more. And then these receptors start to get blocked up with all the opioids, and that's where overdose comes. So our knowledge is you do not increase any tolerance. You cannot get high from it, and you cannot overdose. So people won't abuse that in any single way whatsoever. And we're quite excited about that, and we expect to have that program completing in early 2020. And once again, going back to dual gene therapy, that's our longest program. It's a 4-year program. That'll end probably in the middle of 2020 to later, but so far it's very successful. And that could be, it's one of our biggest programs in the matter that $1.3 trillion a year is lost for people with diabetes because of lack of work, compensation, surgeries, and all those other matters. I guess I went through the time frames with you already, so there's kind of a little thing. We are basically in the preclinicals there now, and once we get them to the IND status, we'll then be partnering with different type of pharmaceutical companies to be able to go through the next stages. Just to give you an idea where the sol gel goes. So basically, the sol gel, if you look at step 1, you spray it into your nasal cavity, and it'll actually sit right at the top of the mucosa, right underneath the brain, the barrier there, and that's how it can leak in quite quickly. And we've already proved this out to date. In PreveCeutical, one of our key people to moving forward, so we have a few key people, but especially now that we get into IND status shortly, is how do we partner with Big Pharma and how do we get people involved? So Dr. Mac Jawadika is our President and Chief Science Officer. I'm the Chairman and CEO, and I just relinquished the title recently as President because now his role is going to be becoming much more critical to us moving forward. He was with Pfizer for 28 years, and at Pfizer he created a drug called Zoloft, and him and Peter also created a drug called Viagra, which you guys all probably know about. As I said to you, was the global. They're looking at the GDP worldwide from 2011 to 2023 is about 1.7 trillion US dollars as we move forward in this industry. Partners we're working with, all 4 R&D projects are done at the University of Queensland in Australia. Queensland is and the University of Queensland is a very, very strong university. They created Gardasil. They consider one of the top 20 universities in the world, and just so you know how profitable they are from not on the university side, but from the drugs that they've created. They actually create about $2 billion in revenues a year from products that they've created to date in their revenue streams. So they've been very successful in bringing things to market. And then we've partnered with QIMR as well for medical research and Murdoch University. Now, key expertise, why the team is really important to making this all moving forward. Myself, I've been in the capital markets since 1997. I've owned businesses my whole life, private and both public companies. I spearheaded the transaction when Aurora Cannabis, creating Aurora Benefits right from the beginning when it was actually Relief Medical, rebranding it, doing the RTO, publicly funding it and moving it forward into the company it's become today. I also helped with Hempco, the strategic alliance and finance between Hempco and Aurora. It was come there. So from there, yes, the cannabis industry is great. I still have a lot of irons in the fire and the stuff I'm working on that you'll probably hear in the future. But what's really important to it, why PreveCeutical came together was that I started looking, we need to start to put together some type of delivery system. So yes, we have cannabis, but doctors don't want you to smoke it. I mean, it just doesn't make sense. So the other thing in talking to the doctors in the 5 hospitals we're working with, the concern that they have is if you go buy cannabis right now let's say we go buy any one of the cannabis brands, and it says 20% THC on the bottle. Health Canada has a plus minus 20%. So that can be anywhere from 16% to 24% THC in that cannabis. Well, doctors now have a big problem saying, well, how do they confirm dosage? They can tell you take 10 milligrams. Well, how do they know if it's 10 if there's a plus minus 20? It's a 40% variable. So PreveCeutical is about creating these tailored brands to be able to take these extracts and cannabis as well and deliver them with dosage and science that doctors can do. Dr. Mac Jawadika, as I told you, Pfizer 28 years, Zoloft, Chief Science Officer, really being strong with us. We're in discussions with multiple pharma companies through him. Shabir Rizan, our CFO. If any of you are familiar with the Canada line that was built in 2010 for the Olympic Games from the airport of Vancouver to downtown, it was a $2 billion transaction. She was the director of finance for that, and she came in on budget and under time, which is really rare to ever hear that in any type of public, government type of constellation. Dr. Harry Parak, our Chief Research Officer. Well, all the sciences behind this and leading the research on it is held by him, and he runs that with a team of his in the Queensland University. Share structure, the company, we have 398 million shares out, and the reason why that, we actually had a lot less, but we chose to do a 5-1 forward split about 11 months ago, and the reason for that was we had about 400 shareholders, but by doing this forward split, it allowed a lot of people that could buy cheaper stocks and valuations, and since then our shareholders have grown to over 3,000 shareholders, so it actually gave us more distribution and a more of a fair value market, because we have people that rather be sellers or buyers, but you're not looking every day sitting still with no volume. Why invest? Well, we're on the edge of coming to IND. Once we have IND on the 2 programs, that's when the values will kick in, the IP value will be sort of be realized and will be part of Big Pharma. And the other 2, which are very important, is the painkiller, it's a non-addictive painkiller, and the dual gene therapy have very, very high values, and they'll be coming into effect in the next year. So those are the reasons why. Anyway, thank you very much. If you have any questions, please don't hesitate to ask.
If you enjoyed this video, please let us know. You've been watching the Richmond Club Report. If you've just come across this channel, please feel free to like and subscribe. I'm sure you'll find a lot of interesting and lucrative investment and trading ideas around here. We'll see you again soon on the next video. Cheers, guys. Have an amazing and profitable day.